my name is Carrie. I'm the treatment coordinator for Dr. Joel Foster in Lee Summit, Missouri. So actually I have had the procedure done on both of my feet. I worked for Dr. Foster for about 3 years before I had it done. I had custom orthotics made on myself. He fit me. I'm genetically kind of predisposed to flat feet. One of my parents has completely flat feet and the other one pronates. And so after 4 pregnancies, my feet took a turn for the worst. Most of my pain manifested in knee and hip pain on one side specifically. So I had Dr. Foster go ahead and evaluate me, talk through it, and we figured out how it could work. So I had it done. I did them 5 weeks apart, and I was very, very pleased. I recommend it because if you can get your alignment corrected before you have further damage like bunions, hammer toes, knees, obviously hips, why not? Why not correct things from the base upward? I've watched one of my parents get 2 knee replacements and the other one have multiple surgeries. I would like to get ahead of the game, correcting things from my feet upward, so that's why I went ahead and took the plunge. Obviously I have complete confidence in the doctor, and it's really easy to speak to patients from experience now and talk them through what to expect on day 3 after the procedure, what to expect 2 weeks later, what it looks like about 6 weeks later, and when they can resume full activity level and not feel like they've had something done to their feet. Yeah, so I wore a walking boot for 2 weeks after having the first foot done. I used crutches for about 2 days. Really, the crutches were just for stability. As long as I had the CAM walking boot on, I was able to get around the house. I tried not to do much activity for the first 2 to 3 days, but I went back to work 3 days later. I had it done on a Friday, returned to work Monday morning. I did have to elevate my foot and put a little ice on it, within that first week just to help maintain some of the swelling. But as far as activity, at 2 weeks I went back into wearing regular tennis shoes and I could walk fine. I walked gingerly and slowly, just feeling like that ankle was a little unfamiliar with the new position it was in. But by the time I was ready to do the second foot 5 weeks later, I was walking, at full capacity on the first foot. No pain. It did feel a little bit, I don't know if shaky is the right word, maybe just weak, still trying to get strengthened in that new position, but I was able to fully weight bear, putting my second foot out of commission. Okay, I had my first foot done in February. I did the second foot in March, and then in May I started playing softball, and I was able to resume activities. I was a little slow running the bases at first, but as the weeks went on and my ankles strengthened up doing regular activities, I was able to resume at full capacity without feeling like I was in pain or having to be careful.